It is with profound honor and heartfelt pride that we welcome a truly legendary figure to Shikshan Setu Dialogues, Dr. Y.K. Amdekar, a name that resonates with excellence, compassion, and transformative impact in the world of pediatrics. Revered as the teacher of teachers, Dr. Amdekar is not merely a distinguished senior pediatrician, he is an institution in himself. His extraordinary career has shaped generations and generations of medical professionals while safeguarding countless young lives. His wisdom extends far beyond clinical mastery. He embodies integrity, humility, intellectual brilliance, and an unwavering dedication to humanity. Known for his evidence based approach, exceptional diagnostic acumen, and deep empathy, Dr. Y.K. Amdekar has become a guiding light in Indian medicine. His legacy is not solely defined by his professional accomplishments, but by the profound humanity with which he has served children, families, students, and society at large. In a world rapidly transforming through science, technology, educational reform, voices like this, voices like his, are rare, grounded in timeless values while deeply aware of the future we must build for our children. And for me personally, this conversation holds even deeper meaning. I am incredibly fortunate and deeply honored to be married into the esteemed Amdekar family legacy. Dr. Amdekar is my husband's uncle, my cherished Chulat Sasre, and a living embodiment of the extraordinary values, wisdom, and service that define this remarkable family. Welcome Dr. Y.K. Amdekar on Shikshan Setu Dialogues, Future of Education. Thank you so much, Kaka, for coming on our show.
Thank you.
So, as I mentioned in the introduction, that he is my Chulat Sasre, so I am going to call him Kaka. So, Kaka, with decades of experience in pediatrics, in medical field, what inspired your lifelong commitment to child healthcare?
I think I graduated more than 6 decades ago. And at that time, the teachers were of a very different kind than what we see today. And we had a system where we were trained by honoraries, not the full time professors. But my honorary teachers used to say they are not full time nor part time, but they are whole time. Anytime you have a problem, come to us. That was the training. And I was lucky to get onto the faculty within a year of my post graduation completion, and I followed the same. Initially, for about 10 years, I worked with my teachers as associates, assistants, and then I took over and I continued to be there for more than 3 decades with possibly continuing the same legacy because we had seen a commitment to a highest order and not getting anything worth spending time. Those days we used to get 100 rupees a month as a traveling allowance, and with honoraries used to spend 25, in general 5 to 6 hours a day and 5 days a week. Service to
Wow.
the poor patients and teaching the postgraduates and undergraduates. So I've seen that dedication. And then after 3 o'clock or so, we used to go to our clinics and maybe work till 9 or 10. But what we got in the morning was precious, and knowledge, keeping updated. What we got later in the evening is for our own self and to maintain ourselves.
Wow. So there was this balance of work
Absolutely,
life balance.
absolutely, absolutely.
Wow. So, having trained generations of doctors, you have seen medicine and the medical field evolve literally. So, would you like to share something about that evolution that you've seen?
I think I recall what my grandmother used to say.
Oh,
And I would ask her, why does she say that? She was not even, well, further school graduate, never entered the school. And then I realized there was a lot of traditional wisdom
Correct.
coming from one generation to another, and the subsequent generation never asked why it could be right or wrong. They believed it was right. It was tested actually that it was right, but there was no evidence to show. Thereafter, we learned traditional wisdom and some medical advances. Thereafter, I continued teaching. I learned more and more of medical advances, and I found people did not much care for the traditional wisdom that was endowed upon us, but we went after the medical advances.
Oh.
And the traditional wisdom was the motto used to be care always, cure if possible.
Oh.
So there were many diseases which had no cure, but there was a care. And not a single time I've seen a patient in the initial 20, 30 years of my own practice quarreling with the doctor, fighting with the doctor, forget taking to the law or whatever. The reason was there was a tremendous faith
Yes.
of the community in the doctors, but for which the doctors had to do responsible work and evidence to the patient that they are doing correctly. I think that is gradually, sadly changing.
Yes. Yeah. Faith. Yes. Yes. So, from your perspective, then, what timeless qualities define an exceptional doctor? Because, like you mentioned, that doctors, I mean, patients used to have this tremendous faith. I mean, doctors have been, for common man, even today, we look at them as almost God, right? So, what qualities define an exceptional doctor, regardless of technological progress, regardless of robotics, regardless of AI?
I think what is most important is the patients don't care how much doctor knows,
Hmm.
but they want to know how much doctor cares. Now that is
Interesting.
important.
Yes.
I may have a big qualifications, I may have a big knowledge, but they want to know whether I would care for them. And the care is visible by simple ways that we were trained. The first lesson to every doctor is a patient listening to the patient.
Oh.
The patient knows what is wrong with him, but we give time for him to say whatever he wants to. Well, there are people who keep on talking irrelevant things that you may check, but more often than not, and in pediatric practice, mother knows the best. And if mother says this is a problem, a doctor should not take it lightly, even if he's sure it is not a problem. I mean, that
Wow.
kind of patient listening.
Yes.
Once you listen patiently, it shows the patient across the table that you are very empathetic and concerned because you have eye to eye contact, you are focusing on what is being said, you are trying to listen patiently. That itself starts a kind of a bonding. And then the history taking starts, it sets the tone for communication. And most important is when I ask a question to a patient and the patient answers, that very answer leads me to the next question. And this kind of an interactive communication almost always used to script the whole disease.
Oh.
That was the power.
Wow.
Now, today the technology cannot replace it. That kind of thing. Then came the clinical examination and a mere touch to the patient.
Yes.
When your son comes with a good merit and then you put a hand on him, that bond really transmits the love and affection from one to another. Same way, the physical examination, gentle and correctly sets the feeling that there is a bond between the two.
Right.
And once that happens, it should end up with communication, counseling, documentation. Now, counseling and communication tells the patient that, oh, be satisfied, you have explained him. Documentation means really I am responsible for it, accountable for it, and therefore it shows the responsibility of a doctor.
Right.
Now, this was taught to us all along, and today we practice the same. Now, technology cannot do that. The
Correct.
robot cannot do the work.
The human
Okay,
touch.
it's a human bond, and that human bond is different. So, every patient should leave the doctor's office by halfway getting better
Yes.
before even the drug started.
Yes, and we have experienced that
Yeah, I mean
sometimes.
that is only because you spend time.
Mm.
Knowledge is the same for all, or I would say ignorance is equal. Knowledge may be a little different, and that is statistically not significant.
Okay.
My students know as much as I know. They know 99%. I know 99.5%. So statistically, there is no difference. But both of us are ignorant. I am ignorant 0.5%, he is ignorant 1%, statistically very much important. So possibly we must know the limitations of science. And you will not believe, Sir William Osler, 130 years ago, was the first physician who took his students to the patient's bedside. Till then, the medicine was trained in the lecture hall. Can you
Oh,
imagine that? And people ridiculed him and say, "What are you doing?" He said, "Unless my students see the patient every few hours, every day, they will not learn how the natural progress of a disease occurs." Those
oh,
were the days. And then he made a statement which is true even today, at the end of 130 years. And he said, medicine is a science of uncertainty, but the art of probability.
that's
Today,
deep.
I must tell every parent that what I am saying is not 100% right, but mostly right. Why? Because I have given honest thought to the whole process and I have used every bit of knowledge. But science itself has limitations.
Mm.
And therefore, I am never sure to be right, but I am sure of two things. I am sure it is an honest opinion, and I am also sure that your life is not in danger. I can correct my mistake. I think if you say this, the patients are very comfortable. I may be wrong, I may correct, but I'm not taking a chance of your life.
Correct.
And then I would be said by the patient, "No, sir, you are very humble. How can you not know?" You get such applause for nothing. Saying that you don't know is appreciated. Only because I'm honest, I can write down, I have not understood today, but I'm sure nothing is serious. And you come back after 2, 3 days. And if there is anything earlier, please come back again.
Oh,
I think that honesty, as put on paper, is missing today.
oh,
And I think that is the biggest change I see now. And therefore, a person who is doing all this is a good doctor. Okay. And a good doctor is not recognized by the number of patients he sees or the crowd in his waiting room or a big name of his in the community, but he's just go by that. I think that is the way the I see a tomorrow's doctor.
wonderful. So, good listening skills, open hearted communication,
Absolutely,
human
absolutely.
touch. I mean, you have beautifully, defined this whole process. So, given that, what do you think should be embedded in the education system so that the future doctors, I mean, I'm not talking about directly the medical journey, but as a primary secondary student, what qualities needs to be imbibed as a parent, as a teacher in education system?
I think the education starts almost from birth, and there is no doctor at that time mostly.
Correct.
But of course, there would be a doctor who would deliver a mother. There would be a doctor who would be a pediatrician at birth. And the story starts even right from conception. That an obstetrician today should prepare the lady to manage the baby.
Mm.
That preparation should start from there. The job of an obstetrician is not just to deliver, but prepare the mother for taking care of a newborn. And to some extent, by trying to tell her how important is breastfeeding, how important is a general approach that a pediatrician would take over. Once the pediatrician comes on the scene, he should spend enough time to tell her how is it. Now I know that when a baby is born, the first and the only question the mother has, I hope everything is all right. Okay. Now there are two ways of answering. The correct scientific way of answering is just now your baby is all right, but you never know, which is scientifically correct,
Yes, but scary.
but practically it is disastrous. So, all would I say that you have been blessed with a very good normal baby. Don't worry. But I have checked your baby, every organ is in place. But I have not yet checked how every organ is working. So I take time. Now, if an old man walks very briskly, and you would wonder how at his age he is walking briskly, you need to see what happens after a few meters. He has to stop, he has to rest, and then he starts walking. That means he is not fully competent. So I explained to her that heart is beating, lungs are working, but I will have to see whether urine is going to be passed or not, stool is passed or not, feeding is acceptable or not, retained or not, all that. So all that is natural.
Yes.
Okay. When you buy a machine, you have tested, just put it on, it works. But you don't know whether it works well. It takes time.
Correct.
When I say this, and then I end up saying, but I expect everything will work well. That's the end of it.
Yes.
Now, I cannot be caught legally for giving wrong statements, okay, or missing out on something. And therefore, the correct way is to assess by day 4, day 5. But today, all over the West, and it's coming up here also, a normal delivery, healthy mother, healthy baby is discharged even in 24 hours. That's not ideal. And if that happens, because of several other constraints, then we must give red flags in writing to the mother. If he if he looks little lethargic, come back again. If he is not feeding well, come back again. Now all those in writing,
Correct.
saying that mostly nothing will happen. Now that's the kind of a thing that you don't want today from the doctors. But one thing is certain that when you buy a machine, there is a brochure with it, how to work.
Correct.
But God there has not sent a brochure with this baby
Correct.
because He expects the parents are intelligent enough. He expects the grandparent must have passed on the traditional knowledge, and if not, He expects the pediatrician would work. Now, when parents are first time parents,
Yes.
they don't have anyone senior in the house, and the pediatrician doesn't do his job, then they are left to just ask the neighbors or go digitally and find out something, which is the biggest mistake today.
Yeah.
So grandparents were there all the time. They had a wisdom. Wisdom was passed on. They were almost never wrong. Today, at the end of scientific advances, I am almost never wrong. No, I am also equally right and still equally wrong as my grandmother was. Only thing I am able to talk in evidence.
Oh.
But the question is, if you jump from the top floor, do you need an evidence that you will break your bones? It is a common sense.
Correct.
The earlier generations had common sense, and today we have left common sense and use the machines for it. I think that is the biggest difference. The real education comes from the parents. And the education is not, there are normal situations. He will stand, he will walk, he will run, he will go up and down. Nature does it.
Yeah.
But to inculcate right habits is a job of a parent,
Yes.
and that habit comes right from near end of 1 year. At 9 months of age, parents must teach every baby what is the meaning of no.
Mm.
If that no is not learned, but then what happens? He takes something and tries to throw. No, 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 don't throw it. He thinks that he is being admired. So he throws. You must say, no. And then if he does again, take it away. The message is clear, this is not allowed. But we just told to the contrary. He feels it's good to throw, and again the mother will say, good, good, good. So I think the start of education at the parent level behaviorally is to tell them what is no. So he asks for chocolate. Yes, but you don't give it, no. Nobody cries. Let him cry. Once he cries for 5 minutes, he will understand crying doesn't get what he wants. He will not cry. He will accept. But if you say, okay, today I will give you, but tomorrow not, the poor man has his own intelligence. He says on Monday the chocolate is all right. Why not on Tuesday? Tomorrow also I will cry and I'll get a chocolate. So these are the mistakes parents create.
Correct.
And then, as you know rightly, that a child mimics parents.
Yes.
So the way parents behave in the house, if the father is shouting towards the mother, okay, if they are fighting, the child learns and says that's the way to go forward in life. So they are role models. A child is just going to follow them. When that doesn't happen, they don't look at themselves, the parents, but just point out, sir, see how he is behaving. I remember an 8-year-old was brought to me because, sir, we caught him smoking a cigarette. I said, my God, what happened? But do you smoke? He said, yes, yes. But then when did, sir, I started smoking when I was 30. Now this 8-year-old wants to
My
ask me if
goodness.
I tell him this is not good, that doctor, is it good to smoke at 30 and not at 8? The child is intelligent to ask me the question. So smoking is bad at all age. You stop first and then don't shout at him. You know that parenting is of 4 types. You have an authoritative parents, you have an authoritarian parents, and you have the parents who are almost negligent or they are permissible. Now, negligence is absolutely not accepted, but the permissible parent is also not accepted. Let him do what he wants. I have enough money, I can manage. No, that's not the point. And then, if he is an authoritarian, he is strict. The child is not allowed to opine himself, to wish what he wants to say, and thereafter his behavior is going to be abnormal. On the other hand, authoritative parent would exactly keep in check everything, but still allow the child to speak out, give his volume. So I always tell the parents that don't argue, but discuss. Then they say, what's the difference between the two? I said, argument is to find out who is right, and the discussion is to find out what is right. Now let the child know that. And if child is right and you are wrong, admit to the child, better I thought I was right, but here you are right. I'm sorry, you are right. He has learned to say if he has not understood, he can be upfront say, I'm sorry. Now, these kind, I remember a parent who came and said, sir, my 12, 13-year-old girl wants to go to stay overnight to her friend's place. So, should we allow or not? I said, of course you should allow. He said, no, but then you never know all that. I said, no, you can monitor. He said, no, but if you monitor, then she feels that, no, no, as if you're after me all the time. I said, there is a method of doing it. So they asked me, no, what is the method? So I said, tell her, yes, you will go tonight and spend the night in your friend's house. But I thought that instead of you walk, no, I will drive you to that and I will also get to know her parents. So they become my friends. Now, you're not monitoring her where she's going, what is the plan, but you want to know her parents. Okay, have a kind of a courtesy call them at our house, then
Correct.
call your friend to stay overnight. The child is happy. But if child is felt that I'm not allowed because they don't have a faith in me, and I'm not allowed, but if I insist, then they come behind me monitoring slowly, hiding. That makes the child not grow well emotionally. I
Yes.
think this is the job of a parent. You will not believe when I see a health problem, It is again the parent's responsibility.
Yeah.
If I see a mental health problem, 200% it's the parent thing. So parents are important.
Yes.
Then comes the school.
Correct.
But what can a school do? Today, 50 children are in one class.
Yes.
You can't blame a teacher.
No.
But a good teacher tries to help everyone within limits. But a teacher guides the student to learn, and the parents show the way how to learn. And therefore, every time when somebody comes and says, "Sir, last time you cured my child," I said, "No, no. When?" He said, "No, don't you remember?" I said, "No, I remember. I did not cure. I told you how to cure a child. You cured. I guided you." The job of a teacher is to guide parents. So back to the parents.
Yes.
And today, if you put a tuition teacher, how can he do well? Your child has to do well,
Yeah.
and you have to motivate him.
Mm.
I think that's why education should be the last in charge of the doctor, including health,
Right.
because everybody knows what is junk food, but
Correct.
everybody likes the junk food. So I should allow once a week a junk food.
Correct.
Okay, everybody likes a cell phone. I should
Yes.
say cell phone not till 5 years. Thereafter, just for 15 minutes. Then I tell a 10-year-old, you choose half an hour
Mm.
between TV, between computer, between iPad, between cell phone, half an hour. At 31st minute, out. And if you don't do it, I've told your mother to snatch it. I've given you an allowance. And I tell him, normally you are not supposed to touch it.
Yeah.
But I know you want
Right.
it.
Correct.
So let's be friends. I allow you, but there is a limit.
Right.
So this is what it is. And lastly, I will tell you one fact that one 4-month-old infant
Mm.
parents came to me. Baby is fine. They said, "Sir, we want to go for a vacation for 8 days. Is it fine to take a 4-month-old child?"
Mm.
So I said, "Look, given a correct advice, it is not.
Yeah.
Because even if you take him on your lap and go by the flight, it's an exertion to that baby. A
Yes.
change of environment makes the babies get upset. Okay, so it is not ideal. But most of the time it may not harm. Okay, but if you ask me, why not go a little later?
Correct.
Okay, she said, yeah, I understand. She went to home and I don't know what she told her mother-in-law. Mother-in-law phoned me and said, "Sir, you have allowed a 4-month-old to go to for a vacation with the parents?" I said, "No, when did I do that?" "No, my daughter-in-law said, doctor has said it's okay." "No, I have not said it okay.
Yeah.
I have given you warning."
Correct.
Now this is how that, and therefore I have had a point both ways. Mother-in-law insists the daughter-in-law should one way. That is wrong. So I've had at least 10 times the occasion in my practice where I call the entire family and talk to them and tell the daughter-in-law, I won't insult, I won't harm, but I would give them the correct advice so that indirectly they know that the daughter-in-law was right, but they were wrong. So I think doctor's job is to repair what has gone wrong.
Yeah.
But I don't think I'm responsible for mental health as well as physical health. Yes, within limits, yes, because when a patient comes to me, I want to monitor the health, both mental, physical. Yes,
Correct.
I can pick up an early deviation. But a teacher can pick up an early deviation. The child is not doing well. But that is small part.
Hmm.
Major part is parents.
Wow. Wow. Those are like a lot of lessons, even
Yeah.
for me as a parent to, and I'm fortunate enough to get that
Okay.
from
I
you
mean, you have
directly.
done so good to your son.
No.
Okay, and marvelous. Okay, and he did not learn in the school,
Yeah.
he learned at home.
Yes.
That's what I mean.
So, Kaka, you did mention about mental health and physical health. And today we see that all the learning disabilities, neurodiverse kids, it's at rise, or maybe there is more awareness. You rightly again said that kids generally mimic the parents. So if I sit with the gadget, the child is going to take the gadget,
Absolutely,
right?
absolutely.
But what is I mean, is it the mental health issues are due to the gadget, or what are the main causes behind it? And how can we protect then our children or the future generation from these mental health issues?
See, the whole era is changing,
Correct.
and we cannot apply the same that you applied in the previous generation.
Absolutely.
So every child today must use a cell phone, digital equipment, but there has to be a limit.
Hmm.
So if you combine that and balance it, if you say no, I know a parent who don't have a TV at home. You know what happens? The child goes to the neighbor and says, हमारे
Oh.
घर में टीवी नहीं है, मैं इधर आके देखता हूँ. No, what's the idea? Should have a TV, but monitor. And the best way is all of you sit together and see the
Correct.
program for half an hour. So today, I think we have to be a bit lenient in moderation
Hmm.
and not be strict to say no. And that's what authoritative means.
Correct.
And I think that is where, even today, with all that, but another problem comes with mental health.
Hmm.
Okay. And I find those who are intelligent are often suffering more often than others.
Oh.
Because a child who comes first, the parents expect him to remain first all the time. Okay. But further, even if parents don't say that, the child understands that parents would be happy if he continue to be first. So parents should say, put your best efforts, don't worry. And then finally, one or two or three or four does not decide how well you will be in life. And I see every time, at least now that I see only second opinion patients, every month there are two, three children who come with abdominal pain when there is no cause found.
Oh.
And you don't believe a cause is stress and anxiety. Okay. And today the competition is so much.
Yes.
But they don't understand that competition. I tell them that it's a rat race today.
Yes.
And what does it mean by rat race? Even if you come first, you are a bloody rat.
Hmm.
What is that? We say rat race, which means don't get into a race, not necessarily to win, but you put efforts. Efforts itself allows you to go in higher in future. So today, I think parents have to kind of, but not that, oh, result doesn't matter. No, result matters.
Hmm.
But I want to see efforts on your part. Then the results could be plus minus, and the results usually fine. And then I give them examples that Einstein was chucked out of the school.
Yeah.
Okay, and when he got a note sealed, and the teacher said, show it to your mother. When the mother opened, she saw all that, and that great mother, okay, that genius has must have come through genes. That mother said, he asked, what is written in that? The mother said, teacher has said he's so good he need not come to the school. Can you imagine that mother saw some spark in her son,
Yes.
but the teachers could not. So here is the role of a mother again.
Yes.
Okay.
Definitely.
And I'll tell you, an autistic child that I know, he was in integrated school.
Okay.
And one day he came home happy and said, you know, Mommy, tomorrow is a selection for drama.
Hmm.
And 5 children are going to be selected. I am sure I'll be the first to be selected. Now the mother started worrying that how can he be selected for a drama?
Yeah.
She was worried when next day she went to fetch him. She was sure he will come crying. But he came happily. And he told the mother, I told you, no, I was selected first. Now the mother would not believe. So she met the teacher and said, he is saying he was selected first. So the teacher said, yes, I know his limitations, but I selected him first, telling the whole class that at the end of the drama, he will clap first. Nobody else should clap before he clap first.
Oh.
I, I admired that teacher. Okay. And this boy kept on saying, I told you, everybody know, I am first.
Wow.
Okay. Means how she understood to make such a disabled child happy.
Correct.
Okay. And that happiness would kind of take him further in life.
Correct.
I think these are examples how parents or teachers could do, but I'm sure as a pediatrician, I have an equal responsibility of monitoring growth, etc.
Right. Wow. So So as a pediatrician, how do you envision the future of pediatric medicine over the next 10, 20 years, especially in the age of AI? Why I'm coming to this question, I'll tell you. So on internet these days, there's this reel that comes up. AI आपका जॉब लेने वाला है. AI है तो डॉक्टर क्या करेगा? I don't believe in this, but I want you to say it with your wisdom. I think if you say it, people are going to trust this. So
Absolutely. I think there is no doubt that medicine is advancing at a very fast pace.
yes.
And I feel no other profession is doing it that fast. Every week there is something new coming, and there is an information available to all of us sitting anywhere in the world. The question is that today we have so many advances, advances in diagnosis, advances in drug therapy, advances in surgery.
Yes.
Today we can replace organs, okay, almost every organ except the brain, but the heart and lungs can be transplanted, the kidney and liver, of course, and skin, of course, and joints, of course. So there is so much of advance. The surgery is moving on to laparoscopic surgery, keyhole, and next 5 years, I can see every surgery through endoscope without a skin incision. Okay, several drugs have come up. Some cancers are being cured. Okay, and today the genetics has come up to a stage where you can know today whether you are inherited some disease from your generation. Okay, you want to know whether you are at risk of such a disease.
Correct.
And the best way you will not know is today cancer therapy, the drugs are same, but which of the drugs would fit this patient is answered by the genetic test. So tailored made medicine.
Wow.
Okay. Now, besides that, there is a telemedicine. I can
Right.
sit here and treat somebody in a village, and in the West, a surgeon sitting in his own clinic is operating on a patient somewhere else.
Yes.
Advances to that extent.
Correct.
Phenomenal.
Phenomenal.
I am very happy with all those advances. But there is a prelude to those advances. And what is that? This is information. What I gave you was information.
Yes.
But what is knowledge? And knowledge is absorbed and retained information. So I must understand what that information means and to whom it would be best applicable.
Right.
That is knowledge. Knowledge is not available with AI.
Yeah.
AI gives you a data. AI gives you information. AI gives you incidence, prevalence, but doesn't apply to an individual. And therefore, you must have an ability to transform information into knowledge. Okay, which means I know why is this happening. The AI will tell you what is happening. And to answer why is happening, I need to sitting the patient across to
Yeah.
know his body, to know his mind, which AI will not know.
Correct.
That is one. And lastly, knowledge is also not enough. There has to be a wisdom. Now people ask me, what is wisdom? So I said, wisdom is to know where the knowledge should be applied and where not applied. That
Wow.
is knowledge. So tomorrow, with so many advances, the job of a doctor is going to be complex. He will have to choose which patient deserves that kind of advance, and I bet 90% will not need any advance.
Oh.
Literally, my guesswork. It's not a studied evidence
Yeah.
based. But 90% get well with simple advice, and more important, the preventive advice. Okay. Well, 10% can do very well
Correct.
with use and so that is wisdom. And I remember my postgraduate asked, sir, I don't understand how will. I said, I'll tell you that. A tomato is a fruit.
Hmm.
The botanists know that. But the wisdom is not to put it in a fruit salad. That is wisdom. And I said, do you know further what wisdom is?
Hmm.
The tomato is available with the vegetable vendor and not with the fruit
Fruit vendor.
vendor. So even those vendors know that this is not to be mixed.
Correct.
Can you imagine? How did they know? Traditional wisdom. You don't go to a vegetable market to ask for a fruit, or nor a fruit vendor to ask for a tomato. That means they know, right?
Correct.
Where do they know? They have been traditionally trained. That's an importance of traditional wisdom knowledge.
Right.
And I feel with all advances, if people forget that basics, they will misuse. And today I tell you, the cell phone is being misused.
Yes.
Most important cause of obesity today in children is the cell phone.
Lethargy.
Yes, multiple kind, vision, posture, everything. And I'm sure AI has started being misused.
Yes.
Today you can put up, I can put up your face and show you are doing nonsense.
Yeah.
Now I'm afraid that I'm not an expert in AI. I don't understand much. But I'm afraid that every new invention will be caught up first by those who misuse it more than those who use it. Who will know where not to use it? That's the knowledge and wisdom. We will not get knowledge and wisdom by AI. We will have to develop our own. Therefore, again, AI will not. Well, AI in medical practice, I can understand. For example, I have a Tamilian mother who doesn't know Hindi, doesn't know English. She can talk to me in Tamil. I can get translated into English. I will tell her in English. She will get it in Tamil. Fine. But
Okay.
in most of the major cities, everybody knows two, three common language. So I think that is not. So advances are good. Problem is when not to use it.
Right.
And just out of, it's not true, but to kind of nail that kind of a feeling, I asked my student, what are the indications of CT scan of brain?
Hmm.
So they tell me many things. I said, but don't forget the common conditions are different. What are the indications? You must have a CT scan. Plain thing. Okay. You must have brain for every patient. Yes. So you have a CT scan every corner. You have a brain in every patient. Then what more do you want? A doctor doesn't use his brain.
Oh my God.
Today that's happening. I have a gadget, no? Why do I examine a patient? I explain, I will get it on CT scan, and the CT scan says normal, but the patient is abnormal. That means CT cannot see everything. I'm sure every investigation will end up.
Wow, that's scary.
I think, therefore, the crux of the problem is you decide how to avoid use those advances.
Hmm.
It doesn't mean that you don't use them. Try to avoid. And the basics that we learned 6 decades ago was try to treat without a drug if possible, if not with only one drug. And try to do without a test or diagnosis, if not possible, a specific single test. And that was considered rationality. And today, rational practice demands that 90% of patients don't need a test and they know just ordinary drugs,
Correct.
few drugs that every doctor should master, understand everything. That is possible for everybody. Okay, but today, unfortunately, there is so much of load of information that a medical student is expected to know everything
Yes.
at the cost of something simple, which everybody feels that is simple,
Hmm.
but the simple only leads to further things. So I think today this is the problem. Advances are excellent, but to know whom not to use it is important. So instead of asking indication for use, I must train them contraindication for use.
Wow. Thank you so much, Kaka, for this valuable insights. I don't think any AI and ChatGPT model can give these answers because this is pure wisdom. Kaka, Zata Zata, something that you would like to tell the parents who are watching this.
I think I wish everybody takes some lesson out of this. And today we have intelligent society in India. We are supposed to have far more intelligence than the Western world. Okay, we may be poor, but we are rich in our knowledge. And therefore, I envisage that if this message goes on multiplying everywhere, then tomorrow's Indian human being will be most happy and healthy right from cared from birth till his old age. And I think I envisage that. We must try that. And by I mean everybody, every individual must take responsibility of his own health, and every parent the responsibility of their children. Don't leave it to others. Others are there to guide you, but others are not there to do the job that you only can do. Within limits, therefore, try your best. I understand there are constraints, but I understand there are also solutions. And I'll end up by saying that J.R.D. Tata had put up a small emblem in his office to say we tried difficult things first and the impossible things next, which is telling us that nothing is impossible. We should not give an excuse. I hope parents take this message. Yes, you ask the doctors what they must tell you more. You ask the teacher how they must guide your child, but don't forget you are responsible.
Wow. Thank you. Thank
Thank
you
you.
so much for
Thank
taking
you.
out the time and
Thank you
speaking to
very much.
our audience. Thank you
Thank you
so
very
much.
much.
Keep watching Shikshan Setu Dialogues, Future of Education, for more such insightful talks, conversations. Take care. Bye.